Hello and welcome back. Today I want to talk about a condition that is widely misunderstood, a condition that has led to countless tragic outcomes, sometimes costing patients their lives. Over the years, I've encountered heartbreaking cases, patients who were misdiagnosed for weeks, sometimes even months, with devastating consequences. And while the root causes varies, one pair of diagnoses seems to appear in almost all of these cases: malaria and typhoid. Far too often, these two diseases are assumed to occur together, leading to misdiagnosis that can delay proper treatment. In this video, I'll share real-life stories that highlight this issue and discuss why this problem persists. Let's dive in. To understand how dangerous this issue can be, let me share some stories from my personal practice. First, let's revisit a case I've shared before. A 40-year-old man who came to me after weeks of worsening symptoms. He had actually been diagnosed with malaria and typhoid and treated with several medications, including injections. But his symptoms only got worse. When I examined him and carried out the right investigations, I found the real cause: hyperparathyroidism due to a parathyroid adenoma, a condition entirely unrelated to malaria or typhoid. If you want to know what happened to this man, how we uncovered this rare diagnosis, and the dramatic outcome, be sure to check out the full video on my YouTube channel and Facebook page. Trust me, it's a story that will both shock and inspire you. Then, there was a woman who was treated for weeks for malaria and typhoid. She had abdominal pain and fatigue that only worsened. When I saw her, we discovered the real issue: chronic liver disease. Another unforgettable case for me was a 31-year-old pregnant woman at 35 weeks of gestation. She was managed for 5 days with multiple antibiotics and fluids for malaria and typhoid. But when I saw her, the diagnosis was clear: peripartum cardiomyopathy, or PPCM for short. PPCM is actually a serious heart disease that can occur in late pregnancy or shortly after delivery. With early detection and treatment, many women recover completely, but if missed, it can have devastating long-term effects or even lead to death. By the time this woman came to me, her body was holding too much fluid. Her lungs was filled with fluid, making it almost impossible for her to breathe. We had to act quickly to give her intense treatment to save her life and also that of her baby. And then there are the cases that haunt me: patients who didn't survive. A 29-year-old man comes to mind. He had been managed for 5 days for malaria and typhoid. When I saw him, it took just 2 hours of thorough clinical history taking, physical examination, and appropriate lab tests to uncover the real issue: acute kidney failure. His kidneys had stopped working for days, causing waste materials to build up in his body. Unfortunately for him, so much time had already been wasted on the wrong diagnosis. Despite our best efforts, we couldn't arrange dialysis fast enough for him, and he passed away just 4 hours later. These cases, each one heartbreaking, show the devastating consequences of misdiagnosis. My colleagues in the medical field have also shared with me several similar experiences. While some patients are lucky to receive the correct diagnosis and treatment in time, many others aren't as fortunate. Let me also share another experience that left me truly alarmed. One day, I walked into a patent medicine store and asked for a specific anti-malaria drug. The dealer gave it to me, I paid for it, and I was about to leave. But just as I stepped out, he called me back and said, "Won't you ask for a typhoid medicine too?" I stopped and asked him why. I told him, "I don't think I have typhoid." He then replied, "Whenever you are treating malaria, you must also treat typhoid because they always go together." Now, this statement reflects what many people think. It's almost as if we believe malaria and typhoid are a sort of package deal. Perhaps they are in a marriage relationship that God Himself has put together and no one should put asunder. But do you know what the reality is? Malaria and typhoid are two entirely separate diseases. Let me give you an example of diseases that actually do often go together. One is chlamydia and gonorrhea. This is a good example. These two are frequently linked because they share similar symptoms and are usually transmitted through the same route, which is sexual contact. Another example of diseases that go together many a times is diabetes and hypertension, which often coexist because of shared risk factors. Risk factors like obesity and what we call metabolic syndrome. But malaria and typhoid, they are different in every way. Let's break it down. Malaria is caused by a tiny parasite called Plasmodium. This parasite enters the human body when bitten by an infected female Anopheles mosquito. This is why mosquitoes are often called the vector of malaria. They carry and spread the disease. Now, it doesn't matter how clean your water is or how hygienic your environment is. If there are infected mosquitoes around, anyone can get malaria. Now, what happens is, once the parasites are in the body, they travel to the liver, multiply, and then invade your red blood cells, causing symptoms which include fever that comes and goes, often at regular intervals. Patients will also have headaches, body aches, and sweating. Now, in severe cases, malaria can lead to some serious complications like cerebral malaria when the brain is affected, or kidney failure, which happens when the infection overwhelms the body. Without prompt treatment, malaria can be life-threatening, and it has actually led to death in many cases, especially in sub-Saharan Africa and in Nigeria where we are. Now, typhoid fever, on the other hand, is caused by a bacteria we call Salmonella typhi. Unlike malaria, typhoid has nothing to do with mosquitoes, absolutely nothing. It spreads through contaminated food and water, making poor sanitation and hygiene the primary risk factor. Now, for you to get typhoid, you must have directly or indirectly consumed feces. This often happens when food or water handled by someone who is infected or a carrier of the bacteria. For example, if someone handling your food doesn't wash their hands properly after using the toilet, the bacteria can spread to your meal. Also, contaminated water sources are another common culprit. Symptoms of typhoid include prolonged fever. Now, as I said in malaria, this is different because in typhoid, unlike malaria, which fever goes and comes, the fever in typhoid stays high and doesn't come or go like we see in malaria. People with typhoid may also experience abdominal pain, diarrhea, or constipation. In severe cases, the bacteria can cause a hole in the intestines known as intestinal perforation, which can be life-threatening. Additionally, the infection can enter the bloodstream, causing a severe and dangerous condition we call a blood infection, which we call septicemia. Malaria and typhoid may sound similar to some people, because both can cause fever and general body discomfort, but that's where the similarities end. These two diseases have entirely different causes, modes of transmission, and symptoms. Malaria is caused by parasites and spread by mosquitoes. Typhoid, on the other hand, is caused by bacteria and spreads through poor hygiene, contaminated food, and water. So, we usually ask, why are they constantly linked together? That's the question we need to answer to understand why this misconception persists. That's the question we'll continue to explore in the next parts of this series. We've seen how malaria and typhoid are often misunderstood and misdiagnosed, sometimes with heartbreaking consequences. But why does this misconception persist? In the next parts of this series, we'll dive deeper and uncover the surprising truths behind this problem. You won't want to miss it. Thank you for joining me in this first part. If you found this video insightful, please like, share, and subscribe to my channel. And don't forget to hit the notification bell so you are the first to know when part 2 is live. Let's continue this conversation in the comments. I'd love to hear your thoughts and experiences. Until next time, stay healthy and stay informed.